mutation in hematopoietic stem cell in the PIGA gene, and this will result into the defective GPI anchor proteins and ultimately absence of the GPI anchored proteins on the blood cells. GPI deficient red blood cells, they have low or absent CD55 or CD59. Normally CD55 is inhibit the C3 convertase and C5 convertase and prevent the activation of the complement system. CD59 normally this inhibit the formation of the membrane attack complex. Whenever this CD59 is deficient in PNH, there will be an excessive activation of the membrane attack complex, and this causes the hole in RBC and result into intravascular hemolysis. As we have discussed, due to the decreased GPI anchored protein CD55 and CD59, there will be uncontrolled complement activation. This will result into the chronic hemolysis. This can be intravascular, while membrane attack complex mediated, or the extravascular due to the lack of inhibition of the C3 convertase, as C3V act as opsonization, and this will result into the increased phagocytosis of red cell by the macrophages of spleen and liver. So in intravascular hemolysis, there is direct lysis of the RBC due to activation of the MAC, and hemoglobin released into the blood stream result into the hemoglobinuria or hemosideruria. This free hemoglobin bind nitric oxide and ultimately result into the decreasing nitric oxide level. Due to low nitric oxide level, there will be smooth muscle dystonia in the form of esophageal spasm and erectile dysfunction, and the elevated level of LDH and bilirubin, low haptoglobin are also seen in the intravascular hemolysis. So these are the we have discussed about the hemolysis and anemia. Now, due to uncontrolled complement activation, there will be thrombophilia or venous thrombosis. As we have discussed, the free hemoglobin binds with the nitric oxide and result into the decreased level of nitric oxide. So there will be more platelet aggregation, more platelet